room scan. Knock, knock. Hi, I'm Maddie. I'm your student nurse today. Can you tell me your name and date of birth?
Jenna Wolf, 9/11/04.
Good. I'm gonna provide hand hygiene and provide privacy. Do you have any allergies?
No.
All right. I don't feel the need to wear gloves or PPE. Today the provider ordered a head-to-toe assessment, so I'm gonna do your vital signs. I'm pretty much inspecting, palpating from head to toe. Do you have any concerns?
No.
Are you in a comfortable position?
Yep.
Do you need anything like the bathroom, hearing aids, glasses?
No.
Okay, I'm going to gather and cleanse my necessary equipment, which I have right here. And I'm going to ask you 3 quick questions. Are you feeling any pain today?
No.
Having any shortness of breath? And do you have a fear of falling?
Nope.
Okay. So first, I'm going to do the general survey. So I'm going to do your vital signs, and then your blood pressure. So first with your vital signs, we're going to do temperature under your tongue. .98.4. Then after your temperature, we're going to do pulse for a minute. Okay, I got 96, good. 60 to 100 is normal. For pulse, and then I'm going to do respirations for a minute. Okay, I got 15, so that's good. Alright, so I did temperature, pulse, respirations. Now I'm going to do blood pressure. So the categories for blood pressure is normal is less than 120/80, elevated is less than 129/80, stage 1 hypertension is less than 139/89, and then stage 2 hypertension is greater than 140/90, and then hypertensive crisis is 180/120. got 112, so there's my marker. Good, I got 118 over 78. Normal. And then I did the stages. So after that, I'm gonna inspect the level of consciousness. So can you tell me your name?
Jenna.
And can you tell me where we're at?
Southwest Tech.
Can you tell me why we're here?
School.
And what time it is?
2:35.
Okay, perfect. Your alert and oriented times 4. And then I'm going to inspect your posture. So I'm just going to sit up. But your posture is good. Write that down. And then I'm inspecting your behavior. So your personal hygiene, speech, mood, and affect. And that's all good. So that is all for the general. I'm going to move to the skin. So first for skin, I'm inspecting your skin for moisture, color, any scars, lesions, masses. So I'm going to do your upper and then your lower. Any bruises, which I see a few. Any like scratches, things like that. And then I'm going to palpate for temperature, turgor, moisture, nice and soft, not dry. So that's good. I'll put that back down. So then I'm going to do I was also inspecting and palpating for edema. The edema scale is +1 is 2 millimeters and it diminishes rapidly. +2 is 2 to 4 millimeters and it diminishes in within 15 seconds. +3 is 4 to 6 millimeters and that's within 1 minute. And then +4 is 6 to 8 millimeters and that's within 2 to 5 minutes. So then I'm going to do the A, B, C, D, E mnemonic for skin lesions. A, asymmetrical, B, border, C, color, D, diameter, and E, evolving. Then I inspected, palpated, and then I'm going to inspect and palpate your fingernails and your toes. Here I'm inspecting for color, contour, shape. Same with your toes. Good. And then I'm palpating for capillary refill, which is less than 3. And then I'm also palpating for texture. Good. All right, that's good. And that's all for the skin. Then after the skin, we're going to move on to the head. So I'm just going to check your facial features. So I'm going to have you smile. Good, no drooping, and symmetrical. And then I'm going to touch your face. I'm going to have you close your eyes and you're going to tell me now.
No. 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 No.
Good. Okay. So after that, those two, I'm inspecting your head for size, shape, color, symmetry. And then I'm going to palpate for masses and tenderness. Are you feeling any tenderness?
No.
Okay. So that's all for the head. Then after the head, we're going to move to the eyes. So first, I'm just going to have you sit up on the side of the bed for me. Okay. I'm inspecting the iris first. This is for color, shape, any lesions, for position, things like that. Good. Then after the iris, I'm inspecting the pupil for size, shape, consensual light, and then accommodation. So you do this. Good, your pupils reacted to light. Same with that pupil. And then I'm going to inspect the sclera for color and lesions. Looks good. And then I'm going to pull down your conjunctiva, and I'm looking for color and moisture, which looks good. Then I'm going to inspect your lids. So I'm going to have you close your eyes. I'm looking for drainage, edema, symmetry, and drainage, edema, symmetry. Okay, lesions, drainage, symmetry, and edema. Okay, good. And then I'm going to palpate the external eye and the globes for any tenderness, masses, deviations, and everything's good. And I'm going to have you follow this, do the 6 cardinal gaze. Don't move your head. Good, and then I'm going to have you close one eye. I'm going to have you read
Chili.
and then
Tracheostomy.
good. Okay, I think that's all for the eye. Then after the eyes, I'm going to move to the ears. So here I'm inspecting the external ear for color, drainage, edema, bleeding, things like that, which both look good. Then I'm going to palpate the auricles, tragus, pinna, and then the mastoid process for tenderness. Are you feeling any tenderness? Again, the auricles, pinna, and tragus, and the mastoid process. And then after that, I'm going to be using the otoscope and looking. For this, I'm checking to make sure the tympanic membrane is pearly gray. Inside, I'm looking for drainage, redness, signs of infection, things like that. For an adult, you pull up and back, and for a child, you pull down and back. So I'm going to pull up and back. Good. Hair distribution is good. Good. Everything looks good there. I'm going to go behind you and I'm going to whisper, and can you tell me what you hear?
1, 2, 3, 4, 5, 6.
Good. Okay. Pick this up. So now that we did the ears, moving to the nose. So here I'm inspecting the nose for color, shape, size, symmetry, deviations, anything like that. And then I'm gonna have you lift up your nose, and in here I'm looking for polyps, deviation, bleeding. I'm gonna use this. And hair distribution looks good. And then I'm going to be palpating the external nose for masses, tenderness, deviations. And I'm going to be palpating the maxillary sinus and the frontal sinuses. So I got that. Then I'm going to have you close one nair and blow out, and then blow out the other one. Then can you close that and tell me what you smell?
Hand sanitizer. Hand sanitizer.
Good. All right. That's okay. That's all for the nose. So we did eyes, ears, nose, mouth. Okay. Now it's the mouth. Here I'm inspecting the external mouth for color, dryness, moisture, bleeding, anything like that. It looks good. And then I'm inspecting the outer lips for color, redness, cracking, things like that. Anything abnormal. I don't see any of that. Then I'm going to look inside and check your buccal mucosa. And I'm looking at that for redness, bleeding again, anything abnormal, which all looks good. Then have you pull down your gums, looking to make sure there's no bleeding, it's intact. Have you stick out your tongue. Here I'm looking for surface characteristics, redness, bleeding, making sure everything's looking okay. Tongue, I'm gonna have you say light, tight, dynamite.
Light, tight, dynamite.
Good. Then I'm gonna look in the back of your mouth. Here I'm looking at the tonsils for size and exudate. And I'm gonna have you say ah as I look at your uvula. I'm going to inspect the hard and soft palate. Here I'm looking for intactness, any lesions, color, any deformities, anything like that. So that's the hard and soft. To palpate the hard and soft, you'd use a finger glove. And to do the gag reflex, you'd use a tongue depressor. And I said, ah, okay. So that's all for the mouth. So after the mouth, we move to the neck. So for neck, we're gonna inspect your range of motion. So I'm gonna have you turn side to side, rotate, good. And then I'm gonna check for symmetry, which it looks good. And then I'm gonna have you turn. I'm gonna check your jugular vein distension for any bulging, pulsations, anything abnormal, which looks good. Going to palpate your carotid pulses. This is for rate, rhythm, force, things like that, one at a time. Good. Then I'm gonna take the stethoscope. I'm gonna listen with the bell, and I'm listening for brutes. Good. And then I'm going to be doing the lymph nodes. So there's 10. I have preauricular, postauricular, occipital, tonsillar, submandibular, submental, superficial, anterior cervical, between your head, deep cervical, posterior cervical, and then supraclavicular. So I think I got them all. So then after the lymph nodes, I did the carotid. I did both palpate and auscultate. So I think that's all for neck. So after neck, move to respiratory. I'm inspecting the respiratory for rate, rhythm, effort, use of accessory muscles, and retractions. And then that. I'm going to have you take your shirt off. I'm gonna go behind. I'm gonna do the posterior. I'm gonna do the tactile fremitus. Can you say 99?
99, 99, 99.
Then I'm gonna do the chest excursion. Take a deep breath. Good, that looks equal. And then while I was doing this, I'm checking the diameter of the anterior, posterior, and lateral chest. So I did that. Then I'm going to do the breath sound. So I have 10 anterior, 12 posterior, and then 6 lateral. So I'm gonna bring it closer. Good, I did 10 on the front. Then I have a turn, and we're gonna do 12 on the back. So we got 12. We did 12 on the back, and I'm gonna do lateral now. Then I have a turn, I'm gonna do this lateral side. Good. So lateral is 6. Gonna back this back up. Okay. So I think that's all for respiratory. Moving on to cardiovascular. First, I'm inspecting the precordium for heaves, lifts, pulsations, color, deformities, scars, lesions, striae, things like that. And then I'm palpating the precordium for heaves, lifts, tenderness, and pulsations. Okay, good. I'm going to say this now before I forget. The S1 is heard clearly at the apex of the heart, and the S2 is heard at the base of the heart. So after I inspected precordium, palpated precordium, I'm going to inspect and palpate your extremities for movement, sensation, temperature, warmth, things like that. So I'm inspecting that, inspecting this, and then I'm going to palpate. And you have good sensation, you can feel that? Yep, okay. Good. I'm going to do your pulses now bilaterally, so I have temporal, radial, brachial. Femoral is between the pubic symphysis and the anterior superior iliac spine. And then I have popliteal. And then I have, if you can flex your legs back, or feet back, dorsalis pedis. Then I'm gonna go here, and I have the posterior tibialis. Okay. So I'm gonna have you sit back up for me. Now I'm going to listen ape to man. Here I'm going to start aortic, pulmonic, herbs, tricuspid, mitral, and then apical. I'm going to listen to the apical pulse for 1 minute. Okay, I got 84, so that's good. And I said we're S1 and S2 are heard clearly already. Okay. Did the pulses. I inspected, palpated the precordium. Did the extremities. Okay. I think that's all for cardiovascular. So after that, I'm going to have you lay down and I'm going to do the abdominal. Put them flat. So first, I'm going to be inspecting, here I'm inspecting for color, size, shape, contour, masses, bulges, lesions, scars, striae, hair movement, or hair distribution and muscle and movement, and just movement. Okay, hair distribution and movement. Okay, then I'm going to auscultate. I'm gonna bring this up. First, I'm starting at the right lower quadrant, auscultating the vowel sounds. And then I'm gonna auscultate using the bell at the aortic, renal, and iliac. Good. And then lastly, I'm just palpating all four quadrants. Here I'm palpating for masses, tenderness, muscle resistance, bladder distension, things like that. Good. Okay. That is all for the abdominal assessment. So now after abdominal, we can move on to the musculoskeletal part. So I'm just gonna make sure you're able to see this. Okay. So I'm gonna set this here. First, what we're gonna do is I'm gonna be inspecting and palpating your range of motion. So I'm just gonna have you do the temporomandibular. We're gonna go extension, flexion, gonna feel. Good. Then we're moving to the cervical spine. So I'm gonna have you go flexion, extension, lateral, and then rotation. So I'm gonna feel, flexion, extension, lateral, rotation. I'm gonna do the spine while I'm inspecting, flexion, extension, lateral, and then rotation. And then I'm gonna palpate now. Here I'm inspecting for lordosis, kyphosis, and scoliosis, which I don't see any of that, so that's good. After the spine, we're moving to the shoulders, so we're gonna go flexion, extension, abduction, adduction, internal rotation, external rotation. I'm gonna feel, flexion, extension, abduction, adduction, internal rotation, external. Elbows, we're gonna do flexion, extension, supination, pronation. Palpate now. Good. Then after that, I'm going to move to the wrists. So we're going to go flexion, extension, rotation. I'm going to feel. Good. Moving to the hands and the fingers, we're going to go flexion, extension, abduction, adduction. Good. Moving to the hips, we're going to go flexion, extension, abduction, adduction, rotation. Flexion, extension, abduction, adduction, rotation. I'm gonna feel. Good, and then knees, flexion, extension, I'm gonna feel. Good. Then I'm gonna have you sit so they can see. We're gonna do dorsiflexion, plantar flexion, inversion, eversion. I'm gonna feel, dorsi, plantar, inversion, eversion. Okay, that's good. You can stand back up. Here I'm going to be testing the muscle strength, size, shape, symmetry. I'm going to inspect first and then palpate after. We're going to start with the sternocleidomastoid. We're going to turn our head. I'm going to go against. Good. Then the trapezius, shrug your shoulders. Deltoid, up. Bicep, tricep. Hands. Hand grips. Good. Fingers. Good. Hips, abduction, adduction. Good, I inspected and palpated. Knees, I'm gonna have you go, I'm gonna have you sit down for this. This is quadriceps and hamstrings. So you're gonna go up and then back down. I'm gonna palpate up, palpate down. Good. Then you can stay sitting. We'll do dorsiflexion and plantar flexion. So dorsi up, plantar down. Just go up and then down. Good. I got the hand grips. For that. Okay. Gonna do your gait. So I'm gonna have you take a few steps forward and then turn back around and walk back. Good. We're gonna do the Romberg's test. So I'm gonna have you stand with your eyes open for 30 seconds and then closed for 30 seconds. We're gonna speed it up since time, but it looks good. A positive Romberg test would be if she falls over or loses balance. You can lay back down. I'm gonna have you do finger to nose for neurological. Good. And then I'm gonna inspect your memory, so immediate, recent, and then in the past. So for immediate, I'm gonna tell you blue sock bed, and then I'm gonna have you repeat it to me later. For recent, what'd you do yesterday?
Had a test.
And what age were you at in 2020?
16.
Okay. I'm gonna have you repeat those 3 words back.
Blue sock bed.
Good, your memory's good. I did finger to nose. I'm gonna do the Babinski response. So here, I'm gonna go up, and there's a response, so good. Okay. So that is all today. Do you need anything else before I go?
Nope.
Are you comfortable?
Yep.
All right. I'm gonna make sure the bed's low and locked, side rails are secure, collards within reach, room is risk-free of falls, table is near. So to perform hand hygiene, the 5 moments are before touching a patient, after touching a patient, when touching patient's belongings, before a procedure, and when touching bodily fluids. I'm going to gather and cleanse my necessary equipment and take that out with me. I'm going to document my findings and report anything per agency policy, and I'll upload that to OneNote. If you didn't need anything else, thank you and have a good day.
Thank you.
I'm gonna check the time, see if I forgot anything. I did hand grips. For the pupil, I said size, shape, consensual light, accommodation. All right, I think that's all.